Hey guys, how are you? I'm back again. I've been traveling a lot, so this is why I haven't been presenting in a while. But today we have an interesting case, as usual. It's a non-edited video, and it's a very interesting case because it's a Morgagnian cataract with capsular fibrosis. So it's very nice. I'm sorry for the noise. It's kind of wild here, Yeah, we have a lot of noise and nice sound, but it might be a little bit with noise. Okay, so here we go. I'm gonna present this case to you. Okay, here we go, and we're going to play it. Okay, here, as you can see, we have a Morgagnian cataract, and if you look deep down beneath the fibrosis you see there, you will be able to see that it's a really brown cataract, so really brunescent cataract. But I'm going to find a surprise, which is a Morgagnian cataract. Okay? Okay. So here I am injecting trypan blue. It's kind of low here. I don't know if it's might be the internet. I am far away in the mountains, so this is maybe why I have bad internet, but I hope it goes well. Wait, I'm going to try to fix this a little bit. Okay, here we go. Okay, now we wash the trypan blue, and I'm gonna forward a little bit, just forward a little bit. Here we are trying to make a rhexis. Okay, we are starting the rhexis now. I am choosing a spot without fibrosis, but as you can see, I'm going around the fibrosis, trying to look at the central fibrosis there. As you can see, I'm trying to go around it so I can have a complete CCC. Okay. We have to go slow, we cannot run. It's very important to have a complete rhexis, and we get a good rhexis. If we're going to see in the future some videos of fibrosis, I have a lot of videos of fibrosis, and if you can see, it's better to have, as you will see in the future, it's better to have an ugly rhexis than no rhexis at all. But right now, we have a good rhexis, and as you can see in the video, it's a little slow. I'm sorry again because of the internet. I'm in the countryside of Italy right now. So here I'm going in, and you will see here I'm going to go forward. This is a different kind of tip, and you can see that we have a milky cortex. Okay, we have a milky cortex, and as the milky cortex comes out, we will be with the remaining nucleus that bounces. You can see how it tumbles. And one of the functions in cataract surgery of the epinucleus is to give stability to the nucleus. Okay, so here we have to impale deep with high vacuum to have a good hold of the nucleus, and then go with horizontal chop, go all the way to the equator, as you saw, all the way to the equator, and perform a very nice horizontal chop. Okay, very nice. Here you saw that I didn't go deep, and it was a little bit more difficult. So remember, you have to go deep. You have to go deep, high vacuum, and chop. Here For the chop, I am performing a safe technique with, I will show you that in the future, to avoid to rupture the capsule while chopping. I show all of this in the FACO course. And here again, I chop the other way. I use the same maneuver to avoid rupturing the capsule. In our FACO course, I explain all of this. Okay? So we continue, we go on, and now with our nucleus already divided in 6 fragments, we can go on with the surgery as usual. You will see it is a really, really hard cataract, but with our FACO machine, which is fantastic. I won't give names, but if you see the tip, you will know which name is it, because it's a fantastic machine. You can FACO anything. You can FACO anything. I don't remember performing an extra cap, maybe for 1 year or something like that. Okay. A manual M6, I mean, not a traditional extra cap. Okay, now I stop. And you guess, why did I stop? Yes, soft shell technique described by the great Steve Arshinoff. Soft shell technique to protect our endothelium, because we have high power with this kind of cataract. Maybe we are in 40. In my machine, every machine is different. In my machine, 40 is like, for example, I don't know, 80 in an Alcomar. Okay. So we continue performing phacoemulsification. Remember to protect your endothelium. If you need to protect more the endothelium because of any reason, because of the cataract, because of the cornea, you have to stop and visco. Okay, we have a 4-step protection, endothelial protection classification, which we show to our fellow, and we showed in the FACO course. And we classified endothelium in 1, 2, 3, 4 plus protection, depending on what we want, and it depends on the endothelium and the cataract. So as you can see, here we're advancing. I'm going to advance a little bit faster. Okay, now we are with our last fragment, and I want you to notice something. Notice I impale my last fragment, try to crush it a little bit, and then I go on protect my posterior capsule. Yes, always protect your posterior capsule. Our neighbors down there. Okay, very nice, very slow. The last fragment, you have to go very slow. You see how the capsule wants to come. Did you see the stria? Okay, so and now notice what we have there. This is the milky epinucleus and the milky cortex that is stuck to the equator of the capsular bag because we have fibrosis. So it's stuck. It's like we have attachments in the capsular bag to the cortex. So now I'm going to go in. My help. Okay, here we go. Now you can see I will go in with my IAA, and I'm going to try to take out the cortex, and you will see that it's not easy. It's not easy at all. It's stuck. It has attachments. The same fibrosis that you saw beneath the posterior capsule, you can find that in the equator. You see, it's stuck. I pull. You will see. It's very difficult. I do this all the time. You have seen that. You have seen that before. You see? Look, look, look. It's stuck there, right there, in our 10, in the screen, our 10. Okay. Okay. Now it comes nice and easy. When we break the attachment, it comes nice and easy. But what can happen if you pull and it's very, very attached? You can, and it's not in the equator. If it is in the equator, it's okay. But if it's below, we can cause a peripheral hole in the posterior capsule. Okay. So now visco, and now we are going to open the last part. You will see the last part. Here we go. Now we have injected the IOL. Okay, we have injected the IOL, and we're going to aspirate the OBD, and that's it. That's all that I wanted to show you, maybe. Don't know then if it's anything interesting. No, there's no more. Okay. Okay. So we're going to stop sharing. Okay, guys, that's it. I really hope you enjoy it. I'm glad I'm back with you. I'm really sorry I have been traveling a lot. Traveling a lot lately. We have been recently in Uruguay, in Punta del Este, with our dear friends from Uruguay. They are fantastic, fantastic people. You should go to Uruguay someday. I want to say hi to my friends, Andres, Fede, everyone. I don't want to to forget anyone, but I really made good friends there. Uh, uh, one of these days, I'm going to make a video. Uh, I'm going to make a video showing you how good we stayed. We had in what a good time we had in Uruguay. I'm going to show you something. I'm going to show you something. Wait, I wanted to show you. Here you go. Just wait a second. I'm sorry. Just wait a second. Here, I wanted to show you this. This is us in Punta del Este, Uruguay, with all of the guys. And I want to say hi to them. Here you go. This is the other one. With all of the guys. I say hi to them. So right now I'm in Italy. Doing a lot of things, interesting things. I will tell you in the future. And I really hope you enjoy this. See you soon. Bye.